Hi, everyone. Welcome to our webinar on hormone replacement therapy, specifically Biote hormone replacement therapy. We're going to be discussing that today. My name is Dr. Kim Harris, and I am the owner of Prescott Medical Aesthetics and Wellness here in Prescott, Arizona. And a large part of what we do here is hormone replacement therapy for men and women. We have two certified providers on staff, myself and Dr. Amber Walls, offering this service. And so today we're going to be just kind of going through a lot of information about hormones, the therapy, and answering any questions you may have. So if you have any questions, you can go ahead and type it in the chat box. I'll keep an eye on that and try and answer questions as we go along. And then I'll also be leaving some time at the end to answer any questions people might have. Let's go ahead and get started. All right, so the main topics that we're going to be discussing today relating to hormones would be what are hormones and why are they important? What is a hormonal imbalance and what can we do about it? So to get started, what do you need to know about hormones? Who can and should you believe? Because there is a lot of misinformation out there. And what are the potential solutions for a hormonal imbalance? So first, let's just talk a little bit about what hormones are. Hormone, the word itself, is kind of a hot topic right now. A lot of people do hormone replacement therapy. We talk a lot about, oh, I think it's my hormones that's causing my weight gain or whatever. But what hormones are, they're just chemical messengers throughout the body that are made to control body functions. And they control a lot of different things. So some examples of hormones that you might have heard, we'll be discussing today: estrogen, testosterone, thyroid hormones, but also progesterone is a hormone. And then there are other ones like prolactin, insulin, you may have heard of, and melatonin is also a hormone. And the way that they work is it's actually a lock and key fashion. So there's a receptor and there's a hormone that comes in specific to that receptor. And once the hormone is there, it can activate whatever system that it's intended to do. So an interesting question is, are we losing our hormones because we're aging? Or do we age because we lose our hormones? Which comes first? Is it the loss of hormones or is it the aging that's causing it? Hormones control a lot of body functions, including metabolism, blood pressure, sleep-wake cycles, blood sugar levels, sex drive and function, inflammation, and a host of other functions in the body. But more important than discussing hormone names and function is, how do you feel? Are you feeling like you are stressed and angry all of the time or irritated? Or do you feel calm, energetic, and connected to your partner? Are you feeling stressed, tired, and tense? Or do you feel like you have the energy to do all of the things that you want to do in life? Aging is really a privilege, no matter what people think of it, but quality of life can diminish if we're not feeling vital enough to do the things that we want to do later on in life. So that's where some hormone balancing can come in. If any of these symptoms sound familiar to you, if you get fatigue, especially in the afternoon, if you have any mood swings or anxiety, tension and irritability, difficulty falling asleep or staying asleep, any kind of mental, emotional problems like depression, anxiety, lack of focus, if you're having trouble concentrating, brain fog, difficulties at work, any night sweats or hot flashes, weight gain, joint pain, all of these are possible symptoms of a hormone dysfunction or low range of hormones. So I just wanted to talk a little bit about why I got into hormone replacement therapy. So I'm a naturopathic doctor. I was trained in school on how to do hormone replacement therapy, usually with topicals, so with creams. And really what I found was that it was minimally effective for patients. It didn't treat their symptoms very well. And, also it's kind of a difficult way to apply hormone replacement. And we'll talk about that in a little bit. And so, some of my mentors had talked about Biote and pellets, but Biote specifically and how much it affected their patients' lives. So I went and got training about 2 years ago, and I haven't looked back. I see wonderful results with patients on a consistent basis when it's done correctly. So when we're talking about Biote specifically, we are working on balancing 3 to 4 hormones depending on the patient. So testosterone, estrogen, and progesterone for women, and then thyroid for any patients that need thyroid replacement. And we also bring in some, supplements, pharmaceutical grade, medical grade nutraceuticals to help kind of balance some other, things that might be going on. So let's talk about what's happening with the aging process. Andropause, obviously specific for men. Sometimes it's called male menopause or menopause, and that can happen to men in their 40s and 50s. And the statistic here that's listed, it says 20% of males over 50 have low testosterone. I actually was surprised, and I wanted to go and update that for you. That's actually about 40% of males over 50 have low testosterone. And I would guess many more than that have suboptimal testosterone, not just low. It's really common in men that have blood sugar issues like diabetes, high blood pressure, sleep apnea, or like snoring, those kinds of difficulties. And low testosterone is linked to early heart disease and other conditions. For men, the symptoms of low testosterone that we typically see, obviously, it's related to libido. So if males are having trouble with sexual function or drive, but also, I find in the males, they're having trouble with irritability. Low testosterone in men makes them very cranky. And then, loss of drive at work. So those men that are in their 40s, 30s, 40s, 50s, that have gained weight aren't moving like they used to and are just struggling to really thrive and excel in their jobs. A lot of times just doing some testosterone replacement for them can help them get back on track. So just a little bit of facts about testosterone. It is present in both men and women. And I have been surprised at how much of an effect testosterone has on women's health. Obviously men have a lot more testosterone, but women certainly need their fair share of it as well. So men start losing it in their 30s, and that just increases every year. And women start losing it, I would say late 20s, early 30s as well. And I think there's a lot of reasons for that. People ask me all the time, like, well, why do we see these drops in testosterone and hormone levels? And I really truly believe a lot of it has to do with lifestyle, number one, and then environmental factors, number two. We have a lot of chemicals that act as endocrine disruptors in our environment. And if we're not extremely careful about avoiding, and in some cases we cannot avoid those endocrine disruptors, that's probably partly what's causing this kind of earlier andropause and menopause for a lot of women. All right, so what do we see when we do testosterone replacement therapy for men and women? I tell patients I see just an increase in drive in general. So yes, sex drive can increase, but also your drive for, work, to get up and get things done that we need to do in life. People that are falling asleep on the couch at 7 o'clock at night, sometimes just boosting some testosterone can help with that energy. I've seen it help with depression and anxiety, helps improve memory, focus, libido, and sexual function. But then we get into this other part of it where we see a lot of protective benefits for patients long term. So it's going to help protect your breasts, bones, brain, heart, helps improve muscle strength and function, and can help reduce body fat. All right, let's talk a little bit about the women, menopause, because I think that's all the people we have online today is women. Menopause is a pretty well discussed topic. It's everybody's going to go through it if you live long enough, obviously. 3,500 women a day enter menopause. And, a lot of women will try and muscle through the symptoms, but you can start getting symptoms many years before you enter perimenopause, and they can last for years afterwards. So, we're looking at symptom relief for a lot of women, but also we have that other protective part where as we enter menopause, we start to have increased risk factors for other diseases and conditions, and hormone replacement therapy can help mitigate some of those risks. This is very common. We see heart disease common in women that are premenopausal, but that number goes up a lot after menopause. And part of the reason for that is loss of hormones. So we talked about testosterone. Let's talk a little bit about estrogen. So we know that estrogen loss causes hot flashes and night sweats. That's pretty commonly known. But, as we go through menopause and lose those female hormones, we also lose a lot of collagen in the skin. So women will notice themselves aging more quickly. It also helps increase serotonin and dopamine. So the women that are having depression and anxiety, mood swings that are very common around menopause, hormone replacement can help relieve some of those. It also helps with bone density, increased bone density and bone strength. And we'll talk a little bit about that later. But osteoporosis is extremely common in females, especially in the United States. And so this is an easy way to help prevent bone loss going forward. It helps maintain memory and prevent diseases like Alzheimer's and memory loss, reduced cognitive function. It improves all of your cardiovascular markers, and again, helps protect your bone, breasts, brain, and heart. So let's talk about the options for hormone replacement therapy, because there are a lot out there and it can get confusing. So when we're looking at hormone replacement, there's two main categories. We have synthetic and bioidentical. Synthetic means that it is completely synthesized in a laboratory. Those could be pills, patches, or shots. Bioidentical, the big benefit with that is that your body recognizes it as an identical structure to the hormones that you would be producing. And those can also be done in pills, patches, a topical cream or gel, or the pellets, which we offer here. A lot of women come into my office and they're terrified to be on hormones. They're like, I would never consider hormone replacement therapy. It is too dangerous. And this study is where that idea came from. So in 2002, the Women's Health Initiative study, which was, I think, the largest study done on hormone replacement therapy, was started. And then a few years later, it was stopped because they were seeing a huge increase in stroke, heart attack, breast cancer, and blood clots in those patients. So what came out of that was, we're going to stop all hormone replacement therapy for women. It's dangerous. We shouldn't be doing it. Millions of women got taken off of their hormone replacement therapy. And so that really started a lot of fear about hormone replacement. But the main difference that we see is that was synthetic. Those were they're conjugated equine estrogens. They are, in my opinion, not to be used for women. We do see large increases in those things: strokes, heart attacks, breast cancer, blood clots. We do not see that with bioidentical hormone replacement therapy. So if women come to me on oral replacement therapy, synthetic, I do my best to get them off of it. I do not believe that it is safe. But those side effects that we saw were from synthetics and not from bioidenticals. So that's the main difference that we need to talk about with patients, is that it is safe if done in the right route of administration and the right dosage and the right form. So one option is to do patches. There is a bioidentical patch that's available. The problem with that is absorption mainly. A lot of women have trouble absorbing through the skin. And you have to wear a patch and change it on a regular basis. So it does take a little bit more effort to keep that going. We can do creams and gels, and those are appropriate for some patients. Pellets are not going to be for every patient, but the downside to it is, one, absorption issues are huge. Two, you're having to rub in sometimes significant amounts of cream every day, and you cannot pass that on to your partner, your pets, or your kids. So it can be a lot of hassle for patients. Injectable testosterone for men is available, and a lot of men do okay on that therapy, but we do see a lot more valleys and troughs with that. So they'll feel great for a couple of days and then really hit a low point. It can make them very cranky. And because it's synthetic and not bioidentical, we do see increased risk factors for certain conditions. So let's talk about pellets, which are my favorite. They're actually plant-derived. Like I said, they're bioidentical, so they're identical to what your body would produce. I think the best thing about it is that they last longer than other therapies. I tell patients it is a set it and forget it type treatment, although there will be usually some either supplements or medications that need to go along with it. But what we really see is once those pellets start getting into your bloodstream, you have a steady level of hormones for anywhere between 3 to 6 months, depending male, female, dosage, and your metabolism. There are a lot of studies behind it. It's actually been used for a long time. It's just really now coming into wider popularity, but there are a lot of safety studies that have been done on it. We can individualize your dosing based on your labs, weight, activity level, and symptoms. And once you're healed from the procedure, which for women is about 3 days, you don't even know it's there. So patients tend to really like this type of hormone replacement. This is a graph. It shows, so you can see with the purple oral graph that you get a good blood level, but you have these spikes that come and go each day. So, midday, you'll have a good amount of estrogen or testosterone in your body, but that goes down overnight. Patches last a little bit longer, but you do still have those valleys. And you can see with an implant, and this isn't 100% correct because they do decrease over time, but you really have a pretty steady state of hormones between 3 to 6 months for most patients. So just to recap kind of the Biote method of pellet therapy, we're working on the right kind of hormone, which is bioidentical, and in my opinion, the only kind that should be used. The right amount, we do individualized dosing. Dr. Walls and I are both naturopathic doctors, and so we really work hard to individualize, make sure we take a good history for every patient, consider any risks, but also the benefits of hormone replacement therapy for each patient, and then the right delivery system. So in my opinion, based on research, the safest forms are either pellets or topical hormones or sublingual. And then of those three, the easiest is pellets. So we have easy, effective, and safe. Just a little bit of more background about Biote. There's hundreds of studies on it. They've been used for over 75 years. They are clinically very effective, convenient. Side effects are low. We'll talk a little bit about that in just a minute. But really, it does increase your blood levels more effectively than any other hormone replacement that I've seen. So it does help prevent bone loss without any negative side effects. Breast health, I'm just going to run through a few studies on the possible risks. So one of the concerns with hormone replacement in the Women's Health International study was increased risk of breast cancer. But what we see from these two studies that testosterone alone does not increase the risk of breast cancer. And in fact, in some studies has shown that it decreases the risk, and that testosterone with estrogen does not increase the risk of breast cancer, and neither does estrogen alone. Here was a long-term study of breast cancer survivors. And when they were on hormone replacement therapy, breast cancer recurrence was lower in the hormone replacement group. Mortality rates were lower in the group that had hormone replacement. And then long-term total mortality rates were 16 per 1,000 per, oh, sorry. That's confusing. Sorry about that. So anyway, what we see really is that long-term risk goes down for breast cancer with hormone replacement. I'll talk a little bit about bone health, osteoporosis, extremely common. We start to have osteopenia and osteoporosis in women, and that can lead to a whole host of issues, including fractures, which can be very dangerous. And then you can see even increased curvature of the spine. Testosterone can build up to 8.3% of bone per year when on continued hormone or testosterone replacement therapy. Arthritis, another very common complaint. We see it all the time. By 2020, which is already passed, osteoarthritis will be the fourth leading cause of disability. And what we see really is that both estrogen and testosterone can stimulate precartilage cells and can help with some kind of aches and pains that go along with arthritis. Brain health, Alzheimer's disease is just a terrible disease, and we continue to see those, the incidence of that go up. But what we do know is that women who are on estrogen replacement are 50% less likely to develop Alzheimer's disease, and men with low testosterone are 3 times more likely to develop Alzheimer's disease. Heart health, we talked about the increased risk of cardiovascular disease postmenopausal. Estrogen can really help decrease cholesterol and LDL levels, which is the bad cholesterol, helps increase HDL levels and decrease triglycerides. And there are numerous studies that show benefits of testosterone on the heart. For men, same thing, decreased testosterone replacement can decrease total cholesterol and LDL, increase HDL, the good cholesterol, and decrease triglycerides. And we also see more lean muscle growth and less body fat in men who are on testosterone replacement therapy. Okay, so let's talk about the downside of pellets, because obviously everything comes with some risk. Most commonly what we see would be maybe a little bit of fluid retention after the first pellet insertion. That can cause a really transient weight gain for some people and can cause a little bit of swelling. So if you get side effects, let our office know. We can certainly help kind of reduce some of those either naturally or with medications. We can get some breast tenderness and nipple sensitivity. If you have not had estrogen in your body for a long time and we give you a good dose of estrogen, your estrogen receptors are going to wake up. And it is common to get some breast tenderness after your first round of hormone replacement therapy. It's possible to get some uterine spotting and bleeding, which can be bothersome, but also very treatable and preventable with the right medications. Sometimes we'll get a pellet extrusion where it works its way out. Very uncommon in women, a little more common in men, especially if there's no body fat. And then I'd say probably what I see most commonly for women would be an increase in facial hair growth and acne. And that can be related to dose. And then also, there's a lot of things that we can do to help reduce the risk of those side effects. Or if you get them, we can help you get rid of any unwanted body hair. But what I tell women is honestly, you're probably going to feel so good that you won't care. We can work on those issues with you, but if you feel a lot better, a little bit of hair growth on your face is doable. For men, we do see reduced testicle size and decreased sperm count, and it can lead to temporary and permanent infertility in men. So it is not for men who are planning to have any children in the future, but most of our men have already gone through that phase of their life. All right, just to recap before we wrap up here, hormone imbalances can happen in men and women at any age, typically starting in your 30s and 40s. Not all therapies are equal. Not all are going to be as safe as pellet therapy is or as effective as in treating your hormonal imbalance. It is not a one-size-fits-all approach. So people are going to have different dosages, which is a good thing. Our bodies are all different. So we want to make sure that it is customized to each patient. And then, a common question we get is about labs, because they'll have seen their conventional provider and they may say, oh, your hormones are fine. The range for women for testosterone, I think, is maybe 12 to 60. And that's a huge range. You're going to feel a lot better if you're closer to 60, and then if you're closer to 12. But a provider may say, oh, your testosterone level is 12, you're fine. Well, you're not going to feel fine, honestly. So just sometimes what we can just call it optimization. It's not that you have a low level, it's that you have a suboptimal level. So we're going to work on getting you closer to optimal so you can feel better. And we do run a complete set of labs before we do any hormone replacements. So, we run estrogen and testosterone in men and women, vitamin D, a full thyroid panel, B12, and then just some kind of basic blood markers to make sure that you're healthy. And it all starts with a pretty simple blood test. So I just wanted to go through a couple of cases that I worked with patients. I had a 36-year-old male came in complaining of low libido, extreme irritability, and difficulty focusing on his job, and significant weight gain. So when we tested his levels, he was at 213, which is nowhere near optimal. He was so low as a 36-year-old male. So we did pellet therapy on him, actually treated him with a pretty high dose. And at his 4-week improvement, his 4-week follow-up, he reported significant improvement in mood, libido, drive, and focus at work. And he was able to start working out again because he had better energy. And his labs post were 814, which is so much better for men. No man is going to feel good at 213. It's just not going to happen. My second case here was a 48-year-old female post-hysterectomy. She came to see me already on estrogen and testosterone, but she was on a cream, and she had been for years, and she was still struggling with severe issues with sex drive, sleep problems, difficulty to climax sexually. She had some weight gain, dry skin, joint pain, frequent urinary tract infections, because of vaginal dryness, and she was also having some urinary incontinence, and that has to do with the vaginal tissue. And even on estrogen and testosterone cream on a daily basis, her estradiol was undetectable and her testosterone was under 12. So you can see that for her, even being on a cream was not effective. So we did go ahead and test her, treat her for with some testosterone and some estrogen. And when she came back at 6 weeks, she had a complete resolution of a lot of her symptoms, including vaginal dryness. She had no more urinary incontinence. Her libido was back. She was having much better sleep, and so her fatigue was better. And she describes it as life-changing. So all of that being said, it starts with a blood test and a consultation. So we want to make sure that hormone replacement is safe and effective for you. And that starts with a 45-minute initial evaluation where we check you out, draw your labs, make sure everything is healthy and that you're safe to continue this treatment. And you just have to give us a call. So right now through the end of May, we're actually having a special on hormone replacement therapy. It's $50 off an initial consultation with Dr. Walls. And she can get you started if you are interested in hormone replacement therapy. So that's the end of our presentation. I'm going to stay on for a few minutes if anybody has any questions for me. If not, thank you so much for attending. We appreciate it, and we will see you soon.